So welcome to ENT student. Now we are trying to tell about squamous part of the temporal bone. So it is forming the major lateral surface of this particular temporal lobe of the brain and most of the lateral surface of this particular temporal bone. It has got a vertical portion and horizontal portion. At a junction where the horizontal and vertical portion is there, so there you are going to have these type of processes like anterior and posterior one, and it is going to prolong forward, thinned out like zygomatic process of the squamous temporal bone, which is going to articulate with the zygomatic bone. Here we find the this temporomandibular joint, which is sitting in the glenoid fossa. If you take this glenoid fossa, it is in front of the external artery canal. So in front of the external artery canal, and the roof of which is formed by the thinned out portion of this superior, this particular part which is there is the root of the zygomatic process, which we have divided into the root of the zygomatic process going towards anterior and posterior. So anterior and posterior parts are thicker, and in the middle it is thinner, below which there will be a glenoid fossa. So this is called as the root of the zygomatic process. We have already told that this particular root of the zygomatic process, which is there, wherein the horizontal part and vertical part of the squamous temporal bone are going to meet, it is going to form like that, and it is going to go posteriorly like supramastoid crust. If you take, this is the mastoid bone, this is the supramastoid crust. So you could find the spina fingri over here, the posterior superior part of the external artery canal, and this particular vertical part of the squamous temporal bone has become horizontal here, and once again behind the external artery canal it is going to run down vertically. So that is the retromeatal part of the squamous temporal bone. We have written as retromeatal STB, retromeatal part of the squamous temporal bone. So at the end of the day, we have to memorize that zygomatic process is a part of squamous temporal bone. It is going to form major lateral surface. It is going to protect the temporal lobe of the brain and very important for the ENT surgeon. Thank you very much.